Hi everyone. I'm En Haogong, founder and CEO at Saddle Medical. We are a healthcare technology company focused on using AI to improve medical imaging. And our mission is to really accelerate a better care to everyone from faster, safer, smarter imaging that powered by AI and especially generative AI. So we talk about a lot of imaging problems. I think previously presenter also talked about like a prioritization for imaging because imaging is really valuable. It's used a lot in clinical settings, and also it's usually an entrance point and endpoint for many clinical trials. But on the other hand, imaging has always been way costly and inefficient. There are increasing demands, but from provider side, hospital imaging centers, they always have trouble to leverage the technology to the best. They have aging technology, a lot aging scanners, and also many patients are underserved because they have to waiting for a long time to get their exam scheduled. And even when they get to hospital, they have to waiting for a long time, and they have to stay inside the tube for a really long time. So all this is because imaging take a lot of data to generate the clinical data you need. So in last maybe almost decades, there are a lot of discussion. How about let us to using AI to improve radiology? Maybe the first thought people think about, let's using AI to replace radiologists. But there has been a lot of development, and radiologists has been shown it's really hard to be replaced. And get deeper looking at the issue, actually, radiologists are never the bottleneck for either the cost or inefficiency. Think about a patient is waiting to get scheduled exam. They are never waiting for a specific radiologist. They are waiting for the service line to open a slot from time perspective, from space perspective, from the availability of the scanner, to get into the scanner to acquire the data that's really important. So what we're working on, the solution to solve the pain point is to provide better data through AI to generate the data in a faster and safer new paradigm. And because that's actually really impactful for both the cost and the reimbursement, that's the imaging side. The exam is actually when patient get direct touched. By improving the workflow, the efficiency of the imaging part, we can really shorten the exam so there are more patients can be served quicker. So fundamentally, we can help the provider to serve more patients better through AI, through generative AI, through our AI solutions. And also, we get the first hand from a scanner. We can enrich it, enhance it, and eventually get better data to the downstream that we have shown leads to better diagnosis. So that's actually really can solve a lot of pain points and a bigger market. We have got around 5 FDA clearance so far in the last 5 years, and the flagship product, SADA-PET, SADA-MR, in short, they're using AI, and lately using like multi-contrast transformer, the state-of-art generative AI model to generate better data faster. So usually we can do around 2 to 4 times acceleration, which means our customers, direct-facing customers, the hospital imaging center, they can serve 2 to 4 times more patients with almost the same cost. And the benefit actually to all the stakeholders. For the patient, even to get better care, better experience, and also better data for better diagnosis. And for the facilities, for the provider, hospital imaging centers, they really can leverage their multi-million-dollar purchase of the scanners well, so they can serve more patients better with increased top line as well. So they actually see a clear ROI. And for the radiologists, they see better, more critical, better quality images, so they can make clinical decisions more confident and quicker. And with that, we actually really have working closely with clinicians. The goal is really to not use AI to replace radiologists, because there's always a trade-off between cost in radiologist time and radiation dose. And again, it's the image quality and diagnostic quality. So here, AI is not to replace human beings, but to create another layer of value so we can renegotiate the quality and the cost trade-off. So there's no more trade-off. We can get better data faster. And the clinical facing product, we right now commercialize a SaaS product. SADA-PET, SADA-MR, SADA-GET, basically, in short, it's a SaaS product. With direct-facing hospital imaging center, we can make them around 4 times more efficient. So they can do around 2 to 4 times more patients. And we have got clinical validation from multi-center studies, get regular clearance, and really have shown global product market fit. Our product has deployed over 500 sites globally so far. And more important, also another issue, another interest come to the AI, generative AI session is really, we have found our generative AI solution can not only help the provider, but help the pharma side, because we can create better biomarker faster. And for all the radiology data, the quality is really the most important part. And for maybe around a third of radiology exams, we also need to inject pharma product like contrast dye to show the biomarkers, to show the pathologies. By using AI, generative AI, we're actually able to generate better data with less dose. So we actually have been helping several pharmaceutical partners to make them product, their drug, lower dose, cheaper to manufacture, able to ship more longer distance for radiology, like radiation dosage, but also actually deliver better quality, better performance, visualize the pathology better. So that's really the value for using AI to generate better data in a faster, safer, new paradigm. And we have run several case studies. So customer, like a hospital image center customer, happy to adopt it and adopt it enterprise-wise. So usually we talk direct to the enterprise-wise, the hospital networks or image center chains, and because they see a clear ROI to improve, the minimal usually see 30%. The max we already show customer can even double their throughputs, double their patient serve. So the additional patients almost pure profit, but fundamentally there's also quality improvement. The team not only have, like a lot of the technology is built based on my PhD research at Stanford, but we are not only just having researchers in the team, we have industry veteran from GE, Philips, Siemens, etc., to really understand how to scale the product line. And so we have scaled several products, commercialize it, and understand how to sell to hospital image center chains. And I think the adoption has been incrementally improved, around 10 times growth in the last few years. But fundamentally, what we want to build is not only just one single product, but really a generative AI, a data infrastructure that we get first-hand data from a scanner, and there are a lot of value we can further harness to deliver to downstream. With that, we are able to penetrate, say, MR exam, deliver more values, and also get to more exams. MR account for around 20% of all the radiology exams, so we are able to scale around 4 or 5 multiple times, scale to different modalities. And last but not least, we have been trusted by global market leader from the manufacturer side and the pharma side, and the key is really to deliver better care to all the patients. Yeah. So to sum up, we see in a way untapped bigger market. With the leading technology, we are able to commercialize into FDA-cleared product and commercialize it and show a clear global product market fit and the willingness to pay, because we can really deliver ROI to the hospital image center, the provider, but fundamentally, it's really using AI to save cost, because they are $1 trillion cost, and the goal is to use AI not to replace human beings, but to help everyone get a better care. Thank you.
Thank you. Do we have some questions here?
Thanks.
Hi.
Just a quick one. Thank you for the presentation. Quick question. Where in the continuum of capture for the modality do you implement? Do you implement on the modality, in the RIS or the PACS, or downstream processing? Just, it wasn't clear to me.
Oh, sorry. I have one slide, but your time exceeded.
It's all right. Very quickly through it, and I was like...
Yeah, I can quickly go through it. Let's see, where's Lisa? This one. Yeah, so basically, we capture first-hand data from scanner.
Got it. Thank you.
Yeah. Okay. Yeah.
Do we have any other questions?
Are you aware of any of the large machine manufacturers building in AI, like GE recently? And do you view that as a competitive offering, or how do you treat that?
It's a great question and often get asked by investors. So the answer is, I think in the bigger picture is always, you can say software and hardware, AI is software and hardware, right? So in the bigger picture, all the vendors want to deliver, like eventually the new scanner is faster, better quality, so there are competition on that sense. But down to the real commercialization, for example, we have built a partnership with Siemens. The Siemens latest MR and PET MR scanner is the most expensive scanners, will have our features built in. And I think that eventually it's a win-win scenario. They help us to distribute, but we also capture a third of market through them, right? And also there, we have working with GE, with different manufacturers. And fundamentally, what we believe is still eventually a different paradigm, different payment model, different customer segment. So their competitor is still within GE, Philips, Siemens, and the one we try to collaborate with, we usually can help them to win the market faster. So I think there are different ways to think about it.
Thank you. Do we have any other questions? Okay, well, let's have a round of applause for all of our 10 startups. It's amazing.